Are you taking vitamin D3 and K2 supplements? If you're a senior, you need to stop right now and watch this entire video. I'm going to reveal why taking these vitamins without consulting your doctor could actually be harming your health. This is critical information that could save your life. Hey everyone, and welcome to Revitamen. Today we're diving deep into the truth about D3 and K2 supplementation for seniors. We're going to cover everything you need to know about these popular supplements, the hidden dangers, and the safe way to use them. But make sure you stick around until the end because the number one reason you absolutely must talk to your doctor first is something that shocked even me, and it could be the difference between helping and seriously harming your body. All right, let's not waste any time. The biggest danger most seniors don't know about, and we're starting with a huge one, is that vitamin D3 and K2 can have serious interactions with common heart and blood pressure medications. Let me explain why this is so critical. If you're taking blood thinners like warfarin, which millions of seniors rely on to prevent strokes and blood clots, vitamin K2 can completely counteract these medications. Vitamin K2 promotes blood clotting, which is the exact opposite of what blood thinners are trying to do. Imagine taking a medication to thin your blood and then taking a supplement that thickens it. You're essentially working against your own treatment. This interaction can lead to serious complications, including stroke, heart attack, or dangerous blood clots. If you can just understand this one interaction, you'll already be ahead of 90% of people who are supplementing blindly. And if you thought that medication interaction was serious, you have no idea what's coming. The final reason we'll cover is even more critical and affects almost every senior differently. Trust me, you don't want to miss this. Okay, moving on to danger number 5, which is the risk of hypercalcemia, or too much calcium in your blood. Here's what most people don't understand. Vitamin D3 increases calcium absorption in your intestines. That sounds good, right? We all know calcium is important for bones. But here's the problem. When you take D3 without proper medical supervision, especially at high doses, your body can absorb too much calcium. This excess calcium doesn't just strengthen your bones, it can end up in places you definitely don't want it, like your arteries, kidneys, and soft tissues. This can lead to kidney stones, which are incredibly painful, arterial calcification, which increases your risk of heart disease, and in severe cases, it can cause confusion, fatigue, and even heart rhythm problems. Your doctor needs to monitor your calcium levels through blood tests to make sure you're in the safe zone. Next up is danger number 4, which is the individual variation in vitamin D needs. This is something that gets overlooked all the time. Every single person has different vitamin D requirements based on their age, weight, skin color, geographic location, existing health conditions, and current vitamin D levels. What works for your neighbor might be completely wrong for you. Some seniors are severely deficient and need higher therapeutic doses under medical supervision. Others might already have adequate levels, and additional supplementation could push them into toxic territory. The only way to know where you stand is through a blood test that measures your 25-hydroxy-vitamin D levels. Your doctor can interpret these results and recommend the right dosage specifically for you. Taking a random dose from the internet or because your friend recommended it is like taking someone else's prescription medication. It's dangerous and irresponsible. Another critical issue is danger number 4, which is kidney disease complications. As we age, our kidney function naturally declines. Many seniors have some degree of chronic kidney disease, and they might not even know it. Here's why this matters for D3 and K2 supplementation. Your kidneys play a crucial role in converting vitamin D into its active form, and in maintaining the delicate balance of calcium and phosphorus in your body. If your kidneys aren't functioning properly, taking vitamin D supplements can lead to dangerous imbalances. High levels of vitamin D in people with kidney disease can cause a toxic buildup of calcium and phosphorus, leading to a condition called hyperphosphatemia. This can cause severe complications, including bone disease, cardiovascular problems, and can actually accelerate kidney damage. If you have any level of kidney disease, even mild, you absolutely must work with your doctor to determine if D3 and K2 are safe for you and at what dosage. Now let's talk about danger number 3, the risk of vitamin D toxicity. Yes, you can absolutely have too much of a good thing when it comes to vitamin D. While vitamin D toxicity is rare, it's becoming more common as more people take high-dose supplements without medical supervision. Vitamin D is a fat-soluble vitamin, which means your body stores it in fat tissue rather than excreting excess amounts like it does with water-soluble vitamins. This means it can accumulate over time. Symptoms of vitamin D toxicity include nausea, vomiting, weakness, frequent urination, and kidney problems. In severe cases, it can lead to bone pain, kidney stones, and life-threatening heart rhythm abnormalities. The dangerous part is that these symptoms can develop slowly, and by the time you realize something is wrong, significant damage may have already occurred. Your doctor can monitor your vitamin D levels regularly to ensure you stay within the therapeutic range and don't cross into toxic territory. Self-prescribing high doses because you read online that more is better is a recipe for disaster. And the second to last danger, number 2 on our list, is another incredibly important one: the complex interplay between D3, K2, and magnesium that most people completely ignore. Here's what's fascinating and critical about how these nutrients work together. Vitamin D3 increases calcium absorption. Vitamin K2 directs that calcium to your bones and teeth instead of your arteries. And magnesium is required for vitamin D to be converted into its active, useful form in your body. If you're taking D3 and K2, but you're deficient in magnesium, which about half of all seniors are, the vitamin D can't work properly. Even worse, taking vitamin D when you're magnesium deficient can actually deplete your magnesium stores even further, leading to muscle cramps, weakness, irregular heartbeat, and other serious problems. Additionally, the relationship between these 3 nutrients affects your parathyroid hormone, your bone density, and your cardiovascular health in ways that are incredibly complex and individualized. Your doctor needs to assess your entire nutritional status, not just 1 or 2 vitamins, and determine the right combination and dosages for your specific situation. This is something I see almost everyone doing wrong, taking isolated supplements without understanding how they interact with each other, and it's sabotaging your health results. And the moment you've been waiting for, the number 1 reason you must talk to your doctor before taking D3 and K2 is that you could have an underlying condition that makes these supplements extremely dangerous for you specifically. This is the big one, so pay close attention. Certain medical conditions make vitamin D and K2 supplementation potentially life-threatening for you. If you have hyperparathyroidism, your body is already producing too much parathyroid hormone, which raises calcium levels. Adding D3 to this situation can cause severe hypercalcemia. If you have sarcoidosis or certain types of lymphoma, your body may be producing too much activated vitamin D on its own, and supplementation can push you into toxicity rapidly. If you have atherosclerosis or a history of heart disease, the wrong ratio of D3 to K2 or taking them without proper magnesium levels could accelerate arterial calcification rather than prevent it. If you're taking medications for osteoporosis, diabetes, seizures, or steroids, these can all interact with vitamin D metabolism in complex ways. The terrifying truth is that you might feel fine right now while taking these supplements, but you could be slowly causing damage that won't show up until it's too late. Your doctor can review your complete medical history, run the necessary blood tests, check for contraindications, and determine not just if you should take these supplements, but the exact forms, dosages, and monitoring schedule that's safe for your unique situation. So there you have it, the 6 critical reasons why seniors must consult their doctor before taking D3 and K2 supplements. We covered medication interactions, especially with blood thinners, the risk of hypercalcemia, individual variation in needs, kidney disease complications, vitamin D toxicity, and the complex relationship with magnesium. And of course, the most important one, that you could have an underlying condition that makes these supplements dangerous. Now, I have a question for you. Were you taking D3 and K2 without consulting your doctor? Be honest and let me know in the comments below. I read every single one, and your experience might help someone else. If you got value from this video, do me a huge favor and hit that subscribe button so you don't miss the next one. In my previous video, I talked about the top 1 mineral for strong bones after 60. You can watch it. Thanks for watching Revitamen, and I'll see you in the next one.